Okay, so today we're going to be testing the suction unit. You want to test it before every shift to make sure that it's fully charged. So to test it, we're going to press the test button down, turn it to full capacity, and then we're going to kink the hose, and it should light completely up to the top. Once the test is finished, it should turn off. So the test is done. So the batteries are on the side there, and there's some water to clean out the suction after its use. The indications for suctioning is if there is a foreign body in the patient's mouth, or if the patient has a decreased GCS. We're using a rigid catheter today, but you can use a soft tip catheter, especially when using an OPA or an NPA or in a moving vehicle. To use it on the patient, we're going to move them into the recovery position onto their side. We're going to turn it on full. By putting it into the recovery position, you're allowing gravity to remove any of the big chunks that the suction may not be able to get. You're going to put it in the patient's mouth, not covering the hole yet. You're going to go as far as you can see and suction in a circulation out for 10 seconds. If you suction for over 10 seconds, it may cause induced vomiting, hypoxia, or soft tissue damage if you go too far with the catheter. This is the first response kit. They're aboard all of the ambulances and are taken to each scene that we go to. So at the top pocket here, we have all of the vitals equipment. So there is the stethoscope, clothes shears, blood pressure cuffs for the peds and the adults. Below that is the pocket for all like patient forms and PPE, so in safety glasses and all that. The outside top pocket on the side, the smaller pocket, is got the emesis bags in there, and then the one below that is for the diabetic pocket. On the outside large pocket, inside that is all of the wound equipment, wound management, so you've got all your bandages and all the tourniquets and the saline flush. And then on the inside of the kit, at the top, is all the oral medication. So we've got the ibuprofen and all that, and then in the middle pocket is for airway management. So this contains all the different sizes of NPAs and OPAs, from children to adults. Below this, on the right side, is the nebulizer equipment. So we've got nebulizer masks for children and adults. We've also got on the other side of that the adrenaline and the prednisone. In the big pocket in the middle, right at the bottom, is the peds and the adult bag valve masks. We have a LMA bag. We've got an IV roll with all the different drawing up needles, the different sizes, and the saline flushes. We have underneath this all is, we've got some splints. There's usually also a C-spine brace in here. And yeah. Okay. So this is an oxygen bottle. We can tell it's an oxygen bottle because it's white and they usually have black labels saying oxygen on them. They're used on the ambulance. We've got portable ones and a big one that is kept on the ambulance for patients that are loaded and need oxygen whilst being taken to hospital. So on the oxygen bottle you'd find a regulator. The regulator tells us how much oxygen is actually in the bottle, and it also helps us regulate the flow rate of oxygen that is being given to the patient depending on if they're wearing nasal prongs or a bag valve mask or anything like that. So on the regulator we've got two prongs that line up with the bottle there. We've got a Bodac seal. So what I'm going to do is I'm going to slide this on. I'm going to line it up. I'm going to turn it until it's quarter of the way tight. There we go. So now the regulator's on. I'm going to use nasal prongs today to show you how to use the oxygen bottle with an item such as nasal prongs. So nasal prongs require 2 to 4 litres of oxygen. So I'm going to lie the oxygen bottle now down for safety reasons. So I'm going to just pop them in and on. You want to put it on to about 2 litres there. This bottle is empty, but we're going to use it anyway. In real life, they would obviously be full and it would be right up to around the green there. If you want to finish using the oxygen, you're going to turn it off. And what it will do is it will bleed out back down to 0, releasing all the oxygen out. So this is the LifePak 12. It's a defib and an ECG machine. So today I'm going to go over what's in each compartment, where the batteries are, what you would do if the batteries were low, where the printer is. Connected to the machine here that you can see is our ETCO2, our SpO2, which measures the amount of oxygen bound to a patient's blood, and we've also got the 3 lead, which is in there. And then on the back we find the batteries. So battery 1 and 2 here, there's always 2 batteries in there. You want to press this button here to check how much it is in there. So it's fully charged in number 2. Number 1 is also fully charged. If it wasn't fully charged, you just take them out, put them on charge, and you can replace the batteries before the shift. Now I'm going to show you how to turn it on and how to do a 3 lead. So to turn the machine on, we are going to press this on button here at the top. It's just the green one at the top there. So I'm going to go to manual mode.
Electrodes.
So I'm going to press advisory. You can press advisory or energy select, but I'm going to press advisory. I'm going to turn the knob here and go into manual mode. I'm now going to do a user print test. So I'm just going to press options. I'm going to go down to user test, just to make sure that machine is working, everything's fine. So I'm going to press that. While the user test is in progress, I'm going to talk about what is in each compartment. So in this pocket here, you'd find your 3 lead, the SpO2, and the non-invasive blood pressure cuffs. So this is our 3 lead here. This is just plugged into this side over here. We've got our SpO2, and also got the ETCO2 as well, which lives in that pocket. We've got our blood pressure cuffs, which are non-invasive. And this side here, you'd find your test load, and this is to connect to the test load. You've also got your little pads here that you connect to the patient on the 3 lead. You've got some GTN, you've got some aspirin as well. You want to double check that they're not expired before you start your shift. And you've also got a razor in there because some patients might be a little bit hairier, so you want to shave them to be able to attach the pads nice and firmly. So the user test has been passed, and it's just printing out now. So the printer's just down there. You can just open it like that. There's heaps of paper in there. You just want to keep a little bit out, sticking out there. Push it back in, make sure it's nice in like that. And I'm going to show you how to do a 3 lead on a person. So we're going to use Susanna, and we're going to put this on her. So on each of the 3 leads, we've got little things saying where to put each one. So this is our left leg. So we don't want to put them on any bony prominence, otherwise we're not going to get a clear reading. The ones that are on the arms, we want to get as close as we can to the heart. So this one is our right arm over here. This is the right leg. Perfect. So now what we're going to do is we're going to connect Susanna as well to the SpO2. So we're just going to press lead. And we're going to go down to that one there. So her heart rate at the moment is 91. It's gone up a bit. And her SpO2 is sitting around 99. We can see the little sinus rhythm there. It's nice and even. So now we're going to put the volume up so we can hear it. I'm just going to move over to there. And I'm going to press that. So that says QRS volume. You're going to press the QRS volume. You're going to put it up. So now we can hear it going. I'm going to just keep Susanna's wrist. I'm going to feel her pulse as it goes with the rhythm on the machine. So it's correlating. So yeah, it's going at the exact same time, so that's perfect. And we can hear it nice and loudly. We're just going to do a print of her heart rate. To stop the print, we're just going to press the print button. And then we can just rip it off. So we've just got Susanna's heart rate there. Now what I'm going to do is I'm going to show a test shot. And we're also going to do a size as well. We're going to practice the size. We're going to get it bigger and smaller. So we're going to go size there on the side. So we can make the size bigger and smaller. So you can see they've got them bigger now. And we can also make them very small. So you can see they're quite small now. So we're going to put ours back on to about 1.5. And it's nice and clear now. So now we're going to do our test shot. When the person moves around a lot and stuff, you can see the rhythm kind of goes a bit funny, it spikes and is not as even. So to do a test shot, what we're going to do is we're going to press energy select. And we're going to go down to 50, so we're going to keep it quite low. And we've got our test load in. We're going to press charge, and it's charging. We're going to press the shock button. The shock has been delivered, energy's been delivered to the test load. So I'm going to show you again how to disarm it as well. So we're going to press energy select. So it's on 50. I'm going to press charge. And then I'm going to press this button to stop it. So, analyze there.
Analyzing now. Stand clear.
So it's on.
No shock advised.
No shock's been advised to our
Start
test load.
CPR.
And then what we do is we're just going to press advisor again. And we're going to go to lead. We're going to go back down. Yeah. And that gets us back to our heart rate and our SpO2 levels. So we're not using our test load anymore, we're not seriously fine. Alright, Susanna, so we're being dispatched to a 65-year-old male who's collapsed. His wife called the ambulance. Prior to his collapse, it said that he had chest pain and shortness of breath. So we're going to go into the scene, we're going to check for dangers. We've got our PPE on, so we've got our gloves and our safety glasses for protection for us and for the patient. So we're going to go into the scene now. We're going to have a look around. There seems to be no dangers around. His wife's here. So we're just going to check to see if the patient is breathing and responsive. So we're going to put the equipment down to our left so it's easy to access. Hello sir, can you hear me? I'm Jessie from the ambulance, can you hear me? So no response to voice. So I'm going to just check for a pain stimulus. Just going to push behind the ear. So no response to pain stimulus. So I'm going to check for breathing now. I'm going to look, listen and feel. I'm going to look inside his mouth. Just see if there's anything that may be obstructing his airway, causing him to not be able to receive any oxygen. So his airway looks clear. I'm just going to listen and feel. Chest rise and fall and feel if he can see if he's breathing. I'm going to do this in 10 seconds. I can't hear any breathing and I can't feel any chest rise and fall. So this could be a possible cardiac arrest. So I'm just going to call for backup. AT1, can I get backup, possible cardiac arrest? I'm just going to pop a towel under his neck, open his airway. Can you start on compressions, Susanna, please? And then put the AED on the patient. Try and get his heart back into a normal rhythm. Try and get it started again. I'm going to do this working around my offsider. Now the pads probably won't stick in this situation. I'm going to turn it on.
Low battery. Analyzing heart
really
rhythm.
good, Susanna.
Do not touch the patient.
Stop compressions. Nobody touch the patient.
Shock advised. Charging. Stay clear of patient.
Everybody clear?
Deliver shock now. Press shock delivered.
Can you just start back on compressions again, Susanna? Make sure you get that nice
Start
depth and recoil.
CPR.
I'm just going to set up my bag now. So we're going to put an OPA into the patient today. So we're going to measure this using the corner of his mouth and the bottom of his mandible. So that looks like a good fit for the patient. We're going to do this putting it in upside down and rotating it 180 degrees. We want to use OPAs on patients that have a GCS of 8 or less and don't have a gag reflex. If they have a gag reflex, this could cause aspirations and induce vomiting. We're also going to pop an NPA into the patient. So this goes into the nose. We want to lube it up really well before we use it to make sure that it inserts nice and cleanly. So we're going to do it perpendicular to the patient, choosing the biggest nostril, twisting on our way down to make sure we don't injure any tissue up in the nose. We wouldn't use this on patients with facial fractures or brain injuries, as this could penetrate the brain tissue and cause further damage. Doing real well, Susanna. I'm going to set up my bag valve mask now that the patient has got the NPA and the OPA in. With the bag valve mask, we want to use 10 to 15 litres of oxygen per minute. Because the patient is unconscious, we're going to use 15 litres. Making sure that the bag gets nice and full of oxygen. Doing really well. When we get to 30, can you just count me to 30, Susanna? I'm just going to put the mask on. 1, 2, 4, 5, 6, 7, 8, 9, 10. Perfect. So I'm just going to do 2 breaths. Getting a nice tight seal around the patient's mouth. Going a third of the way. Jump back on. We don't want to fully squeeze the bag because this could cause hyperventilation in the patient, cause their chest to rise too
Stop
much.
CPR.
We're going to swap places, Susanna.
Analyzing heart rhythm. Stay clear of patient.
Stay clear of patient. We're just going to, for a minute.
Analyzing heart rhythm. No shock advised. Pause.
So I'm going to
If
start.
needed, start CPR.
So I'm going to do CPR. Susanna's going to wait until I get to 30 and then she's going to jump onto the bag. Perfect. Clear the way. That's it. Awesome, Susanna. You're doing an amazing job. So whilst I'm doing this, I'm going to be asking the wife and any bystanders that may have seen the patient collapse about any prior events that may have caused this collapse, medical history, social history, if he's a smoker or not, if he's got allergies, if he's taking any medication. This is just going to help us to get to know the patient a little bit better, be able to help him a little bit more. Thank you. Awesome. Awesome. So hopefully backup will be arriving soon and they can help jump in and help resuscitate the patient. Awesome. So backup should hopefully be here by now. Thank you so much.